Hey guys, welcome back to Mastering Medicine video lectures. Today we're going to continue with megaloblastic anemia. In first part, we discussed about folic acid and vitamin B12 metabolism. If you haven't watched that video, please watch that and then come to this part. In today's video lecture, we're going to discuss about pathophysiology of megaloblastic anemia, and then etiology or causes of megaloblastic anemia, then about pathogenesis of megaloblastic anemia, about the signs and symptoms of megaloblastic anemia, about diagnosis, differential diagnosis, and treatment of megaloblastic anemia. So let's dive in. First is first, let me repeat a bit section of previous lecture. We discussed about anemia. We define anemia as that when hemoglobin or hematocrit or RBC counts drop below the normal range, this is called anemia. Okay. For example, normal range of hemoglobin inside our blood is around, if it drops below 13 grams per deciliter in male or below 12 grams per deciliter in female, this is called anemia. Or when hematocrit level drops below 41% in male or below 36% in female, this is also defined as anemia. Or sometimes when RBC counts drop below 4.5 millions per microliter in male or below 4.1 millions in per microliter in female, this is also defined as anemia. Okay. Now we said that when we have less vitamin B9 and vitamin B12, it causes anemia, or it causes less production of RBC. Okay, we will discuss it that how. So now, first of all, come here. These were about, for example, hematocrit. We discussed this in previous lecture. For example, this is a blood inside a tube. Okay, amount of RBC inside the tube is called hematocrit. Okay, and this is this normal around 45%, and here is a bit area which is around 1%, and this is made of WBC and platelets, and around 55% of the blood is made of plasma. But anyway, we have talked about them a lot in previous lectures. Now this is very important part, okay, because I want to link this part with pathogenesis and pathophysiology, and this is from previous lecture. So let me repeat it shortly and fastly. First is first, we discussed that to change 5-methyl tetrahydrofolate, this is a form of vitamin B9, to tetrahydrofolate, we need vitamin B12. And this tetrahydrofolate is very important for us to make a type of nucleotide which is called thymidine or deoxythymidine triphosphate. Okay, so this tetrahydrofolate is very important. Okay, plus in this reaction we will change homocysteine to methionine. Okay, so to change homocysteine to methionine and to change 5-methyl tetrahydrofolate to tetrahydrofolate, we need an enzyme which is called methionine synthase, plus we need a coenzyme which is called vitamin B12. So in deficiency of vitamin B12, we cannot change this form of folate to this form, plus we cannot change homocysteine to methionine. Okay, now this methionine is also very important. Why? Because we change methionine to S-adenosyl methionine. We discussed all of them in previous lecture, and S-adenosyl methionine is very important for donation of methyl group. It's a universal methyl group donator. Okay, and we need this methyl group or methylation process for many purposes in our body. For example, we need methyl group for gene expression in DNA. When we, for example, this is DNA, when we want to make from DNA RNA, okay, so from RNA protein, got it? So here we need some methylation process, okay. Plus we need a methyl group for synthesis, we'll talk about it, for synthesis of different types of neurotransmitters. For example, we need methyl group for a synthesis of dopamine, we need it for synthesis of norepinephrine, we need it for synthesis of melatonin, and so on. That's why this is very important, got it? Plus listen me carefully, we will change homocysteine to a product which is called propionyl CoA, and also we will change odd chain fatty acids. We discussed all of them in previous lecture. We will change odd fatty acids and some types of amino acids like valine, isoleucine, methionine to propionyl CoA. Okay, now we need to change propionyl CoA after many steps to methyl malonyl CoA, and we will change methyl malonyl CoA to succinyl CoA, and we need succinyl CoA in Krebs cycle, and Krebs cycle is very important for ADP synthesis. Got it? Now here, this step is very important. When we want to change methyl malonyl CoA to succinyl CoA, here we need vitamin B12 for the enzyme which is called methyl malonyl CoA mutase. Okay, so now this is also very important. In lack of vitamin B12 or in deficiency of vitamin B12, we cannot change methyl malonyl CoA to succinyl CoA. And this methyl malonyl CoA accumulates in the form of methyl malonic acid. And this methyl malonic acid is a toxic substance. We will talk about it. Plus, this methyl malonyl CoA incorporates in the making of abnormal myelin synthesis. Plus, if we don't have enough vitamin B12, we cannot change homocysteine to methionine, and homocysteine accumulation is called homocysteinemia, and this is also a toxic substance. We will talk about it. Okay, so now let's talk step by step, and let's link this part to the pathogenesis. Got it? Now we know that for synthesis of thymidine, we need both B9, vitamin B9 and vitamin B12. Okay, so now if we don't have enough vitamin B9 and vitamin B12, okay, we will not make enough thymidine, and we need thymidine for DNA synthesis, okay, because this is a nucleotide, and we need 4 nucleotides for the making of DNA, and they are adenosine, guanine, thymidine, and cytosine. Okay, so one of these is thymidine. Got it? So now to make from one cell two cells, okay, it means to duplicate our cell, okay, we go through a process which is called cell cycle. Come here, for example, this is an RBC, okay. Now to make from one RBC two RBCs, we need to duplicate all our nucleotides, our DNA, our nucleus, and then it will be divided into two new and two daughter cells. Okay, so now we will go through different phases, and as a collectively all these phases are studying under the title of cell cycle. For example, I'm in rest, okay, and in rest RBC, when I'm on in rest, this is called G0 or G0 phase. So when I enter from G0 to G1 phase, in G1 phase I'll prepare a lot of raw materials. I'll prepare different types of enzymes, different types of proteins, different types of nucleotides, and so on. Then I'll enter from G1 phase to S phase, and this S phase is the phase from which I'm going to make from one DNA two DNA, which is called DNA replication. So this is very important in this space. When I'm gonna make from DNA two DNAs or a copy of DNA, I needed to use a lot of thymidines. Okay, so here if I don't have enough thymidine, so now I cannot synthesize DNA. And when I don't have enough thymidine, I cannot synthesize enough DNA. Okay, so here if I don't make enough DNA, I cannot enter from S phase to G2 phase. Got it? And here, because here I have a checkpoint, okay, and it checks, for example, my DNA, that is this correct or it's abnormal. Okay, so here in this S phase, if I make abnormal DNA, so a process is activated which is related to P53. Okay, and due to this process, this cell goes to apoptosis or to cell death. Okay, so that's why I will not produce a new daughter cell. This is very important. Okay, so it means I cannot make enough cells. So now, okay, so now when I don't have enough cell cycle, it means I cannot make enough new cells. For example, let me link it to erythropoiesis or to RBC. Okay, so now, for example, this is RBC. In the absence of thymidine, okay, the cell cycle slows. Okay, plus cell production slows. Okay, so in a nutshell, I don't have enough DNA and I don't have enough cell. Plus some cells they come out from the bone marrow to the blood circulation in large form, okay, which are called megaloblastic cells, because we discussed that when RBC is maturing, its size is decreasing. So now, because I don't have enough DNA, I cannot mature my RBCs. Okay, so some immature RBCs come out to circulation, and these immature RBCs will have large size. Okay, and there is no problem with RNA synthesis. For example, this is DNA. From DNA I'm making RNA. From RNA I'm making protein. Okay, and one of the most important protein inside the RBC is hemoglobin. So I can make enough hemoglobin. It's not like iron deficiency anemia. In iron deficiency anemia, the problem was with making of hemoglobin, but here hemoglobin synthesis is normal. It means RNA production is normal. Why? Because in RNA production, instead of thymidine, I use uracil. Okay, so in a nutshell, I'll have large cells, RBCs, which are called megalo cells. Okay, plus why is anemia produced? Because i'll have less i'll have less RBCs production, and when RBC counts drop below the normal, okay, so I'll have less RBC in circulation. When I have less RBC in circulation, it means I have less hemoglobin in circulation, but I'll have enough, listen me carefully, but I'll have enough hemoglobin inside one RBC. It means MCH will be normal most of the time. Okay, main corpuscular hemoglobin will be normal. Okay, but as a result of less production of RBCs, I'll have less hemoglobin in circulation. So that's why in the net result, hematocrit level and RBC counts drop below the normal, plus hemoglobin also drops below the normal, and this is not due to abnormal synthesis of hemoglobin. This is due to less production of RBCs. Got it? That's why in cell cycle, thymidine is very important. Plus, listen carefully. In hematopoiesis, it means in production of different types of cells inside the bone marrow, for example WBC, okay, for example platelets, okay, for example RBCs, okay. For all of them, to make all of them, I need DNA, okay. So for making DNA for all of them, I need thymidine. So when I don't have enough thymidine, so I cannot produce enough RBC, I cannot produce enough WBC, I cannot produce enough platelet, okay. So as a result, all cells of the blood decrease, and it's called pancytopenia. Got it? Pancytopenia means that I'll have less WBC, I'll have less platelet, I'll have less RBC. Got it? Now, this is one point that you'll find most of the time, pancytopenia in CBC report, because this is very important for in diagnosis section. Plus, due to abnormal synthesis of gene, okay, apoptosis is activated, and apoptosis is cell death, okay, it is cell suicide. Now, due to lysis of RBC inside the bone marrow, due to lysis of RBC inside the bone marrow, unconjugated bilirubin will be produced. Let me explain unconjugated bilirubin. We know that this is for example, this is an RBC. When we lyse RBC, okay, so we lyse hemoglobin, and when we lyse hemoglobin, so a product will be produced which is called bilirubin, which is called bilirubin, okay. So now this bilirubin has yellow color, and it deposits in sclera, it deposits in skin, and it gives a yellow color for our sclera and skin, which is called jaundice or ectris. Got it? So it means sometimes you will find unconjugated bilirubin level in your blood, or high level of unconjugated bilirubin inside your blood. This is very important in diagnostic section. Got it? Now, because of immature cell productions or immature hematopoietic cells production, you will find some immature WBCs inside the circulation, and one of those is polymorphonuclear neutrophil, okay. For example, this is a neutrophil, okay. A normal neutrophil has a nucleus which has one, two, and three lobes, okay. When you find a nucleus that it has more than five lobes or more than six lobes, this is called poly, means more, polymorpho means shape, okay. So it's called polymorphonuclear neutrophil. It means its nucleus will have more lobes, okay. Got it? So this is very important diagnostic criteria. If you find only one polymorphonuclear neutrophil in the circulation, you can diagnose the patient as megaloblastic anemia, or you can diagnose your patient as vitamin B9 and vitamin B12 deficiency anemia. This is very important. Plus, due to anemia, okay, patient will develop sign and symptoms of anemia, okay. For example, patient will develop fatigue, patient will develop pallor, patient will develop headache, and all of them are due to anemia, and we discussed their mechanisms in full details in previous lectures, that why in anemia fatigue, pallor, and headache and so on develops. Got it? Now, plus patient will have weight loss, and this weight loss is due to malabsorption. We will talk about it later on. Plus patient will have a low grade fever. Do you know why is this occur? Because due to lysis, this is for example bone marrow. So this is a part of bone marrow. Here is this RBC, the lysis occur. So due to lysis of RBCs, due to lysis of different types of hematopoietic cells, okay, a lot of particles will be produced here. Okay, and these abnormal particles activates our immune system, and the causes production of cytokines, and these cytokines causes production of fever or low grade fever. Got it? Plus due to deficiency of WBC, and plus due to abnormal WBCs, patient will suffer a lot of infections. Okay, and this infection is due to lack of WBC. This is a patient, and this patient will have low grade fever, plus patient will have infections, a lot of infections, plus patient will have in advanced stages, patient will have some small bleedings in different parts of the body, and they are called petechiae. They are called, for example, bruisings. Okay, and these petechiae bruisings are due to less platelet counts. Got it? So watch this patient in its hands, in its both hands. You will find some petechiae and bruisings. Got it? Plus all parts of the body that they need rapid proliferation of cells. Okay, they go to rapid turnover of cells. Okay, for example skin, for example GI system, all of them will suffer by the deficiency of vitamin B9 and vitamin B12. For example, in our GI system, this is our GI system. In our GI system, for example, we have mucosa, and in mucosa we have epithelial cells. So for rapid production of epithelial cells, we need a lot of thymidine. Okay, so when we don't have enough thymidines, okay, so now we cannot make enough cells. Okay, and uh, uh, due to this less production of epithelial cells, okay, mucosal cells of GI will be disrupted. Okay, so now patient will develop glossitis. During glossitis, we have some bulgings on our tongue. Okay, and these bulgings will be disappeared due to less cell productions, and patient will have smooth tongue, and this smooth tongue is called glossitis. Got it? Plus patient will have cheilitis. Cheilitis means that patient will have some ulcers. For example, this is the mouth of the patient, and these corners of the mouth, patient will have some ulcers, some lacerations, and these are called cheilitis, and these are due to less cell productions, plus due to infections. Okay, and due to less healing. Got it? Plus patient will develop mucosal atrophy. Got it? And due to mucosal atrophy, patient will have malabsorption, patient will have anorexia, patient will have weight loss. Got it? Plus patient will have GI discomfort, patient will have pain in GI system, patient will have constipation, patient will have, for example, diarrhea, and so on. Got it? So it means we need this thymidine and cell cycle for different parts of our body. Got it? Plus patient will develop skin hyperpigmentation. What do I mean by skin hyperpigmentation? Listen me carefully. Come here to this part. Come here. When we don't have enough methyl group, it means we do not convert homocysteine to methionine, and methionine to S-adenosyl methionine, and then we will not produce enough methyl group. Due to this less methyl group or less methylation, okay, we cannot balance tyrosinase activity. This tyrosinase activity is related to methyl group. Okay, so now its activity increases. In the absence of methyl group, its activity increases. Okay, and when its activity increases, it causes production of more melatonin, and melatonin causes hyperpigmentation of the skins. You can watch it in the photo. Okay, and this hyperpigmentation, this black pigmentation of the skin is reversible when you treat the patient by vitamin B12 or by vitamin B9. So this hyperpigmentation will reverse. Got it? Now patient will have osteoporosis also. In this osteoporosis, bone pain and low density of bone parenchyma. This is due to more homocysteine, because homocysteine is toxic to connective tissue, to collagen tissue, and so on. And also it's due to hyperproliferation of bone marrow. Got it? And also it affects gonads, because in gonads we need rapid turnover of the cells. Got it? Now let me explain this part, and then I'll go to the neurological problems related to the vitamin B9 and vitamin B12 deficiency. Okay, now come here. When we don't convert homocysteine to methionine and methionine to S-adenosylmethionine, it means we cannot provide enough methyl group. Now, when we don't have enough methyl group, we cannot convert norepinephrine to epinephrine, and it's a neurotransmitter, very important neurotransmitter in central nervous system. We'll talk about it. Now, we cannot make melatonin from N-acetylcysteine. Okay, plus we will not synthesize enough serotonin and dopamines. Okay, these are so important. Okay, then due to less methylation, we cannot make enough myelin sheet around the axon. I've discussed nervous tissue in previous lectures. You can watch these lectures. But anyway, this is, for example, a neuron. This is a neuron. I'll discuss it later. And this is the part of a neuron. This is, for example, soma. This part is soma, where the nucleus and organelles are located. This long projection is called axon. This is called axon. Okay. Now these are dendrites. Now around the axon, we have two types of neurons. Some of them are inside the central nervous system. Some of them are in peripheral nervous system. So in peripheral nervous system, for example, if I take a type of cell which is called Schwann cell, and I wrap it around the axon, this wrapping process is called myelination. And this Schwann cell protects, for example, this is a Schwann cell, this is a Schwann cell, this is a Schwann cell. All of them protect our neuron from damaging. This is one point. Point number two, this myelination process helps us for transmission and transductions of impulses from one part of the body to the next part of the body, or for transduction of action potential from one part of neuron to the next part of neuron. Okay, and by the help of myelination we can transmit action potential fastly. Okay, because action potential uh, goes like jumping from one area to the next area. Okay, so now if I don't have enough myelination, okay, so my neuron degrade. Okay, plus if I don't have enough myelination, I cannot transmit action potential fastly. Okay, so I'll develop some pain inside my neurons. I'll develop a lot of complications inside the neuron that we will talk about it later. So now come here again. Now come here. So I need methyl group for synthesis of myelin. Specifically, I have a type of phospholipid in myelin, okay, in which is called, or in cell membrane of Schwann cell, which is called phosphatidylcholine. So for synthesis of phosphatidylcholine, I need myelination. Got it? Yeah, I talked about this, that I need methyl group for gene expression, for DNA replication. Okay, and also if I don't have enough methyl group, I'll make some abnormal cells, and this making abnormal cells increase the chance of cancer. Got it? This is very important. Plus I need methyl group for rapid cell cycle in bone marrow, in GI, in skin, and so on that we discussed about them previously. Got it? Now come here, I'll explain this part also, and then I'll go to neurological discomforts. Now, when I don't have enough vitamin B9 and enough vitamin B12, okay, it means I cannot convert homocysteine to methionine, and homocysteine accumulates inside our blood, which is called hyperhomocystinemia. And this hyperhomocystinemia is toxic. How is this toxic? First, this hyperhomocystinemia produces ROS, or, for example, reactive oxygen species. And reactive oxygen species are dangerous for endothelial cells inside the blood vessels. For example, this is a blood vessel, this is endothelial cell inside the blood vessels. Now, ROS, or reactive oxygen species, they damage these endothelial cells. So normally in normal situation, normal endothelial cell produces nitric oxide, and this nitric oxide causes vasodilation. Plus, this nitric oxide prevents from aggregation, from clumping of these platelets. So now, in damaged endothelial cells, I cannot produce enough nitric oxide. So now vasoconstriction occurs, plus a lot of platelets aggregate together and they make a thrombus. Okay, they make, for example, a thrombus, and this thrombosis is dangerous for our different systems. It causes blocking of blood flow to different systems, and it causes ischemic heart disease. Okay, it causes stroke, it causes different organ failures. So this is not good. Plus, when we damage endothelial cells, these damaged endothelial cells, okay, they will make a plaque here, and this plaque is called atherosclerosis, and this is also dangerous for heart, for brain, for different organs. Got it? Plus, listen me carefully. When when I don't have enough vitamin B12, I cannot convert methyl malonyl CoA to succinyl CoA, and this methyl malonyl CoA accumulates in the form of methyl malonic acid, and this methyl malonic acid is also toxic. It's also toxic for different parts of the body. This is toxic for the nervous system, this is toxic, for example, for connective tissue, and this abnormal methyl malonyl CoA also incorporates in synthesis of abnormal myelin sheet. Okay, so now instead of normal myelin sheet, I'll have abnormal myelin sheet, and this is not good for me, and it causes demyelination of neurons. Plus, listen me carefully, if I don't convert methyl malonyl CoA to succinyl CoA, it means I'll have less succinyl CoA, and due to lack of succinyl CoA, I cannot produce enough ADP or energy in Krebs cycle. I need succinyl CoA for Krebs cycle. So that's why, due to less ATP, I cannot repair my degraded neurons or degraded myelin shears. Got it? So now let me explain neurological complications of less vitamin B9 and less vitamin B12. Now come here, I'll talk about abnormal myelination plus toxicity of homocysteine, toxicity of, for example, methyl malonic acid. I'll talk about less production of different types of neurotransmitters, for example, dopamine, for example, epinephrine, for example, norepinephrine. To make these different types of neurotransmitters, I need vitamin B9 and vitamin B12, or I need enough methyl group. So now let me explain it. Do you know this is a spinal cord? This is a spinal cord. If I cut it and I take a cross section from spinal cord and I show it for you like this, okay, so this will be spinal cord, and this is posterior part of spinal cord, this is anterior part of spinal cord, okay. So now this in posterior part of spinal cord we have a tract, okay, specifically it's an ascending tract, and this tract is called dorsal column medial lemniscus pathway. So as a nature we can till this the dorsal column, okay. So now the most important area which is suffered by vitamin B9 and vitamin B12 deficiency or demyelination, this is dorsal column medial lemniscus pathway, plus some tracts that they're ascending and descending in lateral and anterior column of spinal cord, okay. And as a collectively they are called lateral corticospinal tracts, okay, or anterior lateral corticospinal tracts. Now do you know by the help of, for example, this is dorsal column medial lemniscus pathway, by the help of dorsal column we carry important sensations to the brain, okay, and also we carry proprioception from our different organs to the brain. Do you know what proprioception is? Proprioception means that, for example, when you close your eyes, okay, you will feel your arms, you will feel your limbs in 3D space. For example, I when I close my eyes, I can touch my nose easily because I know where is my this right hand. So this balance of your limbs in 3D space and knowing this that where is my limbs in 3D space, this is called proprioception. Now, when you don't have enough myelination to these neurons, okay, now due to demyelination of dorsal column you will lose proprioception sensation, okay, you will lose some sensations, okay, and due to lateral column you will lose also some sensation. So patient will develop first due to proprioception, patient will develop, for example, when you tell the patient that close your eyes, okay, and stand like this, so now when patient is closing his eyes, okay, he suddenly falls, okay, so this suddenly falls and this suddenly losing control of balance and 3D space, this is called Romberg sign, this is called Romberg sign. Plus when you tell the patient, for example, when you bend the head or neck of the patient or you flex the head or neck of the patient, so patient will sense sharp pain across his spinal cord, and this is called Lermit sign, and this is due to demyelination and degeneration of the different neurons, okay. Plus patient will develop paresthesia, this is very important. This paresthesia is developed in deficiency of vitamin B12, not in deficiency of vitamin B9. So as a collectively all specifically these proprioception, paresthesias and pain, tingling, all of them are developed in deficiency of vitamin B12, okay, not in deficiency of vitamin B9, okay. So now a patient will have tingling, pain, burning, all of them are called paresthesia, and it will be symmetrical in both limbs, okay. And this is due to not conversion of methyl malenyl CoA to succinyl CoA, and this methyl malenyl CoA incorporates in synthesis of abnormal myelin shears. Got it? Plus, we talked that hyperhomocystinemia, okay, and methylmalonic acid, they are toxic to the nervous system. Plus, if we don't have enough methyl group, we cannot make enough neurotransmitters. So patient due to lack of enough neurotransmission, due to lack of enough neurotransmitters, patient will develop mood disorders, patient will have depression, okay, patient will develop dementia, patient will develop psychosis. Psychosis, for example, hallucination, delusion. Hallucination means uh, patient will have abnormal sensation, okay. For example, a patient is looking something that this thing is not located here. For example, patient will tell you that I'm looking a dog here and there is no dog here. Patient will hear some sounds and these sounds will not be there, okay. So these are called abnormal sensations. Plus delusion. Delusion means abnormal belief, and this is not related to specific religion. This is not related to a country, okay. For example, patient will tell you that someone is chasing me and he will kill me, okay, but there is no one to kill him. So this is called false belief. But anyway, plus patient will develop some autonomic nervous system problems. For example, patient will not retain uh, its urine or its feces and so on. Got it? Plus, the most dangerous complication of vitamin B9 and vitamin B12 deficiency, and also patient will develop anosmia. Okay, it means patient will not have enough sense of smell. Okay, and this is due to demyelination of olfactory nerve, or it's due to demyelination of different cranial nerves. Now, the most severe complication of vitamin B9 and vitamin B12, specifically vitamin B9, okay, or folate, is related to fetus, okay, and it's very fatal complication and deadly complication of vitamin B9. For example, let me explain it. We have a structure which is called neural tube, okay, and when it's developing, so its caudal, its cephalic end is, its superior end is uh, important for developing of the head part, and its caudal end is important for developing of spinal cord, okay. So now listen me carefully. We this this tube is open, okay, normally, but we need to close it, and this tube is closing during 22nd up to 28th days of pregnancy, okay. This is very important. For example, let me explain it so clearly, okay. For example, now mother is pregnant, okay, this is first day of pregnancy, okay. 1 month later, it means 28 days later, okay, this mother will sense some signs and symptoms of pregnancy. For example, nausea, vomiting. Plus patient will think that I don't have menstrual cycle, so I might be pregnant, okay. And she will do some tests, okay, so, and it will be confirmed that she's pregnant. But this is the day which is 28th day of pregnancy. This is the time that neural tube is closed or it's opened. There is two situations: it's closed or it's opened, because neural tube is closing during during 22nd and 28th days of pregnancy, okay. Now if it is open, specifically in its cephalic end, in its superior end. So now we cannot close it by treatment. Now when baby is born, okay, now baby will have a complication, a disease which is called anencephaly, okay. A part of its head will be missed, for example, like this. A part of its head will be missed. This portion is missed. This is called anencephaly. If caudal end is not closed, due to caudal end opening, an opening will be developed in the spinal cord. You can watch the photos, okay. And this opening in spinal cord is called spina bifida, okay. And if there is bulging in the part of the head, This is called encephalocele, and meningomyelocele is also a subtype of spina bifida, a severe type of spina bifida. So this is very dangerous complication of vitamin B9, because we cannot store vitamin B9 for more than 2 or 3 months. Okay, that's why in pregnancy requirement of vitamin B9 increases. Okay, and we need a lot of cells here to close these two portions. Okay, that's why during deficiency of vitamin B9 we will not produce enough cells, and due to less production of cells we cannot close this neural tube. So that's why doctors gave, to prevent from this complication, from this fatal complication, doctors gave 400 microgram folic acid, okay, daily before planning the pregnancy, 1 month before planning the pregnancy, till the end of first trimester or as it's needed. Got it? And this is very important for prevention of this fatal complication of folic acid. Got it? And it's not developed due to the vitamin B12, because a patient can store vitamin B12 for more than 5 years. Okay, but it can be developed also during deficiency of vitamin B12. Got it? Now these were all about complications of vitamin B9 and vitamin B12, and also hyperhomocystinemia. Okay, this is also toxic for cardiovascular system that we discussed it previously. Got it? Now we will talk about causes. Okay, first we will talk about causes of vitamin B9 and B12 deficiency. Then we will talk about diagnosis, and then we will talk about treatment of vitamin B12 deficiency.